So our second Etrasimod poster at DDW was a presentation on fecal calprotectin and CRP improvements or changes over the course of the phase 2 OASIS trial. And so we looked at both of these biomarkers to understand across placebo, the 1 milligram and the 2 milligram doses, not only what happened in terms of improvements in these biomarkers, but also whether improvements in the biomarkers were actually correlated with clinical outcome as measured by or as analyzed by complete remission of the disease using the Mayo Clinic definition. And then finally, we did a correlation to see whether CRP and fecal calprotectin correlated together. So what we did see was significant reductions for both a c-reactive protein, or CRP, and fecal calprotectin at the 2 milligram particularly dose of etrasimod over this 12-week period of time in the OASIS trial. Reductions in both CRP and fecal calprotectin were highly correlated among patients who achieved clinical remission, which makes sense. If you see significant reductions in these biomarkers, you're more likely to be a patient that is going into remission. And we saw a moderate correlation between the two biomarkers. So the clinical importance of secondary analyses like these are that they're helpful to continue to think about using biomarkers as opposed to more invasive measures like endoscopy when measuring the disease severity and in particular the response to therapy over time.